My name is Dr. Sarah Oliver, and I'm a pediatrician at Rockcastle Pediatrics and Adolescents.
I'm Dr. Callie Schaefer. I've worked at Rockcastle Pediatrics for 16 years this September. During this COVID pandemic, it's important for our patients to realize and our families to realize that it's important to continue to get your scheduled well checks and immunizations. These shots and immunizations prevent diseases that are infectious and could potentially make children sick this winter.
Another reason it's important to continue to bring your children for their well child checks is that is a great opportunity for us to follow up on any chronic medical conditions that your child may have. Those chronic medical conditions may make them at increased risk from complications from not only the coronavirus but other infectious diseases that are throughout the community. So it's very important to continue to come for those checkups and make sure that your child's chronic medical conditions are under control.
We can do an actual telemedicine visit where we either use Zoom or Facebook to connect with our families over telemedicine. It's been a really effective way to counsel patients and visit with patients without them having to come into the office. But it works really well. I get a lot of good information, especially from the patients who take the phone or video over and tell me, a lot of information. They're really comfortable with technology. And so sometimes I get more information than I get in an exam room with a table and paper on it.
We definitely do not want you to hesitate to continue to bring your children in for visits when they are feeling ill. One great way to get some advice on whether or not your child needs to come to be seen for their illness is to contact our Mommy Call line. That is a line that you can call, and there is a provider from our office on call 24/7 when our office is closed. You can call and speak to one of the providers at any time and get advice about that. And even if you do need to bring your child in for a sick visit, our office has many policies in place to help ensure that they are not exposed to further illnesses. We've kind of separated the time of day in which our well versus sick children come in. Any child that comes in that is potentially sick with a fever or respiratory symptoms that are concerning, they go through a screening process and they are masked and kept away from everyone else as much as possible. So it's still safe to bring your child in if they're sick, and we don't want you to hesitate to do that. The check-in process when you bring your child for an appointment will be a little different than it was a few months ago. The first thing that we've changed is we're asking all patients to call and register from their vehicle before they actually come into the office. And then when it is time for the provider to see you, you'll get a call from our nurse who will tell you that they're ready for you to be seen. And when you get to the office, you can expect for you and your child to be screened. You'll get your temperature taken, and if you don't already have your own mask, you'll be provided a mask that you can wear back to the exam room.
Even more importantly, in 2020, our staff takes hand washing and sanitizing extremely important. While we've always sanitized our hands prior to and just after examining a patient, now we have the added step of wearing gloves for all exams. I walk into a room, I sanitize my hands, I allow it to dry, I put gloves on, I examine the patient, I remove the gloves and re-sanitize.
Another resource that Rockcastle Pediatrics is excited to offer for the second year are the school clinics. This year we're happy to announce that it will be available at the high school as well as the middle school. You can sign a permission form for them to see one of our providers via telemedicine while they are at school. And especially this year, it's going to be important for everyone to get the flu vaccine to prevent other illnesses from arising during this hard time.